Where tetanus was associated with wound and endospores getting into the wound, botulism is generally caused by what is referred to as an intoxication. Okay? Intoxication means ingestion of the toxin. Whether the toxin is contaminating the food you're eating or you've eaten food that has Clostridium botulinum in it, it begins to colonize you and producing the toxin, and then it gets into you that way. But that second one, getting in, colonize you, can occur, but the thing is, the older you get, the more pronounced, the better established your normal flora of your gastrointestinal tract becomes, the lower the chances of you being colonized by Clostridium botulinum. This is going to be more of an issue we see with infants, young children. As you age, the chance of this occurring goes down drastically. So we see that botulism falls into three categories. Infant botulism, okay, this is going to be 70 to 75% of clinical presentations, okay. An infant has eaten something that either has the toxin in it or has the spores in it, and the spores germinate and colonize their large intestine. This is part of the reason why they say do not feed honey to infants. Yes, it is something sweet. Yes, they will like it. But because the honey is a natural product, a direct natural product, no processing, oh, good Lord, hasn't been treated to pasteurize it. Anything that was in the dust that got into the beehive will get into the honey. On the dust, it is guaranteed there will be bacterial endospores. Some of those endospores that will be on the dust that will get into the honey will be Clostridium botulinum. Infant goes, sucks on their pacifier, your finger, whatever the honey's on. Honey passes through into their stomach. The honey gets digested away because basically it's sugar. It's a thick sugar water. But the endospores, the stomach acids do nothing to. It will then those endospores will then pass through the small intestine, where they will start to germinate and become vegetative cells, and then they hit the large intestine, where there is little to no competition. They will establish. As they establish, they will start to produce botulinum toxin, which gets absorbed by the baby and will cause botulism. We see that for adults, the second group, the foodborne botulism, which is 20 to 30% of clinical presentations, this is where you've eaten food. Generally, it's going to be canned foods that were not preserved correctly, whether it's home canned or commercially canned. The food, once it was put in the can, wasn't heated correctly to the high enough temperature for a long enough time to damage the endospores. Think about it. You take something like green beans. Okay, you got them in your garden. They're going to be covered in dust. Okay, Clostridium botulinum is a soil microbe. It's out there. It's everywhere. The dust, soil particles get on your beans. Yes, you may wash them. Yes, you may cook them. But you're not taking them up a high enough temperature that is going to go beyond killing the vegetative cells. It will do absolutely nothing to the endospores. You put the beans into the cans, you put them in a canner, and you raise it up just high enough to do the pressure thing so that the lid sticks. Again, you haven't damaged the endospores. You put those canned beans on your shelf. Given some time, those endospores will germinate, become vegetative cells, and basically there's no competition. There's lots of sugars, lots of proteins and fats there from the beans. The bacteria is going to grow. Sometimes they'll give off gas, so you'll see the lid will pop. Other times it won't. But they will produce botulinum toxin, which will now be mixed in with the beans. You go, you heat up, you eat the beans, and next thing you know, you have botulism. Very rarely you get the third, which is wound. Yeah, just like with tetanus, you step on a nail, you get jabbed by a dirty branch, whatever, and the spores get into a wound. This is a very rare occurrence. This doesn't happen that often, but it's something that should be taken into account in a clinical setting if somebody shows up and they are showing symptoms of paralysis. Have you eaten anything? Blah, blah, blah. No, you haven't eaten anything. Have you been hurt? Any type of wound? Oh, yeah, I kind of got cut here. I got jabbed there a couple of days ago. That's about it. Boom, boom, boom. Ding, ding, ding. Botulism. The botulinum toxin, here, this is going to hit the same neuromuscular juncture that the tetanospasmin would. But here, instead of inhibiting the reuptake of acetylcholine, here it's going to prevent the release. So the signal depolarization comes down the neuron, hits the terminal end, and nothing happens. No release of vesicles containing acetylcholine. Impulse stops. The muscles never receive the signal to contract. They refer to this as flaccid paralysis. This is contrary to tetanus, which is a spastic paralysis. The flaccid paralysis is exactly what it sounds like. All your muscles just go limp. Have trouble holding your own head up because the muscles in your neck will not contract. Your head just lolls to the side. You have trouble moving your jaw, moving your eyes. Given enough time, you'll have trouble breathing. Onset of symptoms, 12 to 72 hours. Half a day to up to 3 days after ingestion of the toxin. It's all going to be dose dependent. Not only how much of the toxin did you take in, did you ingest, but also your size. Okay? I'm a big guy. You've seen pictures of me. So me, what I take up versus a small child, okay, the doses are going to matter more. So when you look at Clostridium botulinum, okay, it's a soil microbe. Turns out that there are many versions of Clostridium botulinum. Okay, going to be different strains of the species botulinum. Okay, A, B, C, D, E, F, and I think a few more out there. Which one you're going to be exposed to is going to be dependent upon where you're at in the world. Okay, this has a worldwide distribution. Okay, keep in mind, if you go to the East Coast U.S., hey, there's a good chance that a hazy day, what you're breathing in, is actually dust that was brought over on the trade winds from Western Africa. Okay, dust goes everywhere. Which botulinum is going to cause you disease? Not only where you're at in the world, but which strain you're getting exposed to. Okay, Not all strains will cause disease in humans. Some of them is going to be more animal-centered. Some of them are going to be more human-centered. Whether it's animal-centered, human-centered, doesn't matter. We're a dead end. We're not really where it wants to be. When it comes to diagnosis of this, basically it's going to be clinical presentation is going to be your first warning bell, okay? Is more than one person in a family who showing symptoms of this? If they are, well, it's something they were all exposed to. If it's only one person, okay, what's going on? Did all the family eat the same food? Have anyone else in the family been around them the whole time? Since it could be food related, they're going to immediately want you to get in touch with local public health, who's going to get in touch with the CDC, so they can start tracking. Okay, was this food you were exposed to at home? Was this food you were exposed to out, commercially at a restaurant? Things like that, so they can start tracing. See if there's anybody else who could have been exposed or has been exposed and just hasn't been able to get to an ER yet. They want to track down the source. Treatment. Turns out we have some pretty good antitoxins. Okay, these are going to be human antibodies against the toxin itself, so IV into the bloodstream and try to bind up any free-floating toxins. This will also bind to toxins that are adherent to receptors, help pull them off. Patient, when they make it to the ER, if they are far enough down, you have progressed far enough, there may be some need to help with breathing, maybe help with getting some blood flow, keep going, so they'll hook them up to those machines, I forget the name of them, that help move the blood. So, normally what you would use for a heart bypass, stop the heart, hooked it up to this machine that will cause the blood to move through the tube, thus move through the body. Could still use that if need be. So they're going to need respiratory and cardiac support. That's what they're talking about in the textbook. Hospitalization is required, okay? Just because they made it to the ER and they're starting to show signs, I can't hold my head up, my face is drooping, things like that. We're going to start the IV treatments, blah, blah, blah. They have to be hospitalized because it will still progress even though you've started treatment, and they need to be monitored just for the bullet above that, for if there's any cardiac issues or respiratory failure that may occur. Mortality rate for this is low, 5%, 5% of cases. I mean, that is, scarily high, but could be worse. Botulism used to be a major problem. Okay, canning foods has been around since the 1800s. Okay, they used to cook the food, put it in cans, seal the cans, send it off. That's where the old wives' tale came from. Not to eat dented canned foods because they thought the denting was, caused by microbes growing in it, food spoiling. Well, it turns out the dented doesn't matter because that's just an outer physical force on the shape of the metal can. What you need to watch out for are canned foods, if they're commercial, metal cans, that have blown up, expanded like a balloon a bit. So they're no longer the truly cylindrical shape. It's now a bit bulb-like. That means that there's been an increase in internal pressure, which means bacterial microbial growth. For home canners, they tell you you're not supposed to, if you do home canning, you're supposed to use the pressure canner. Okay, you're not just supposed to put the cans down in boiling water. Boiling water kills only vegetative cells, does absolutely nothing to the endospores. You're supposed to use a canner. Okay, the canner is basically a home cook's version of an autoclave. Okay, it doesn't get as hot or as pressurized as a commercial or clinical autoclave, but it's pretty close. Put the cans down in there with some water, seal it, add the heat, the increased pressure, and the wet steam will kill all vegetative cells and will damage all endospores so they cannot germinate. When you're canning, you put the food or whatever in, you put the lid on, because remember the lid is just a disc with a plastic wax ring that allows it to seal and melt and seal to the glass jar. And then there's that ring that you use to hold the lid in place. What they now say, and what they've been saying for decades, is if you do the home canning, use the canner, make sure it gets up to the correct pressure for the correct amount of time, and then once it's cooled and you take the jars out, you're supposed to remove that ring. The lid, the pressure, the vacuum pressure, because the air has escaped out of the jar and it's pulled the lid down on it. The heat has melted the plastic wax ring, so it's now adhered to. And that's how you're supposed to store the jar. So if there's any microbial growth, increased gas pressure inside will cause that lid to pop off. You go to pull the jar off the shelf and you see the lid's no longer on it, you immediately throw it away. Okay? That's how you know. Well, turns out not everybody follows that, not everybody pays attention to that, and that's why botulism occurs more often than not in home canning, home prepared foods than it really does in commercial, because restaurants are going to use commercially available, and most of those companies are going to be really scared of getting sued for not preparing the foods, the canned foods, correctly. Not saying it doesn't happen, but usually QA, QC, quality control, quality assurance, make sure that that doesn't happen in most of the larger canning operations.